Good morning. Let's talk a little bit today about Chapter 9, Physical and Chemical Control of Microbes. Controlling your degree of exposure to potentially harmful microbes is a monumental concern in our lives. We've just come through 2 years wearing masks and things like that to control a virus. So the methods of microbial control used outside the body are designed to result in 4 possible outcomes. When we go to clean a surface or a room or whatever, we are striving for one of these 4 things. Either sterilization, we'll talk about what the specifics of each one of these in just a moment. Disinfection, decontamination. Decontamination is also in some areas, especially in the food industry, it's called sanitization, and antisepsis, which is also in clinical arenas referred to as degermation. Sterilization. It is a process that destroys or removes all viable microorganisms. When you are going into an operating room to have surgery, or you are sitting in the dentist chair fixing to have oral surgery, you hope that all of those, and you expect that all of those tools and instruments and the area where you're fixing to be operated on has been sterilized. Disinfection is a process that removes the vegetative pathogens, but not necessarily bacterial endospores. Disinfection tends to remove harmful products of microorganisms like toxins from materials. So when you're disinfecting, say, your countertops at home, you are trying to get rid of all of the vegetative pathogens, but not necessarily the bacterial endospores. Decontamination is a cleansing technique that mechanically removes microorganisms as well as debris to reduce contamination to safe levels. Washing your hands or something along those lines might be considered a decontamination, or generally what we do in the food industry when they come and they remove the table, the dishes from the last table, and they clean that table off. They are decontaminating or sanitizing that table. Sanitization, you see that term used a lot in public restrooms. You know, you'll see the sign. If you ever go into a hotel, there may be a strip across the commode lid that says sanitized for your protection. Antisepsis or degermation removes the number of microbes on the skin. It is a form of decontamination, but it is on living tissues. So think of sanitization, decontamination on inanimate objects, tabletops, again, sheets, pillowcases, those kinds of things. Antisepsis and degermation is on living tissues, so washing hands, etc. When it comes to controlling the number of microbes, there are 3 classes of things we can do. You can have what are called physical agents, and we'll talk about each one of these in a little bit of detail. Chemical agents and mechanical removal agents. If you'll notice the legend down here, the things that are highlighted in blue are for disinfecting purposes. The things highlighted in that sort of reddish color are for sterilization purposes. And then the things highlighted in yellow are either antiseptic or decontaminating. Antiseptic, again, things that are done on living tissues. Sanitization, those things that, again, tend to be used on non-living things. And again, we'll talk about all of these in a little bit of detail as we move through this chapter. The primary target of microbial control are the microorganisms capable of causing infection or spoilage in the environment or on the human body. So if it can cause an infection, if it can make your food product, your potatoes or your onions go bad, or it's something on the human body that might be spread from person to person. Those are the things we're looking at. Populations many times will consist of mixtures of microbes with extreme differences in their resistances and harmfulness. Many of the agents that we can use that we buy over the counter out of the Walmarts and the Targets, etc., those things are going to be mixed products. If you read the label, they may have several different active ingredients, and those active ingredients are going to be effective against a certain group of bacteria or funguses or other disease-causing items. Bacterial endospores have traditionally been considered the most resistant microbial entities. Many of the things that we use, the endospores of certain groups of bacteria are the ones they are absolutely targeting. The idea is if we can get rid of these things, then everything else is going to be taken care of as well. The goal of any sterilization process is the destruction of bacterial endospores. Keep in mind, those disinfection, antiseptic, disinfecting things probably are not getting rid of bacterial endospores. They are getting rid of the actively growing bacteria. But sterilization, we are getting rid of the endospores. Because, as I just said, any process that actually kills endospores will invariably kill all of those things that are less resistant to the treatment. So again, relative resistant rates. As we move down this stage here, you see the resistance is going up. These are the most resistant, so the prions are going to be the most resistant. So as we're going down here, the resistance to agents is decreasing. Bacterial endospores, again, that's going to be your most resistant form of bacteria. Again, we'll talk about prions later. We talked about them some already. These are infectious proteins. Mycobacterium, cause of tuberculosis and Hansen's disease. Then we have the staph and the Pseudomonas organisms. Cysts of protozoans. Again, when we talked about protozoans a few chapters ago, I mentioned that the cyst was a similar structure to the endospore. The trophozoites of protozoans. Trophozoites are the actively growing, mature, ready to develop and can reproduce form of protozoans. Most gram-negative bacteria, these things up here tend to be gram-positive, while gram-negatives are down here. Gram-negatives are a little easier to deal with because they have that outer capsule of lipids, and that is easily removed by simple application of alcohol. Fungi and fungal spores, as we continue to move down. Non-enveloped viruses, most gram-positive bacteria. Here we see the gram-positives. These ones up here, that they just have certain characteristics that give them a little more ability to react. And then finally, enveloped viruses down here as the least resistant organisms. Resistance of bacterial endospores and vegetative cells to certain controlling agents. Heat. Heat is our best agent when it is applicable and can be used. 120 degrees Celsius, required to destroy the vegetative forms, 80 degrees. So you see you have significant heat difference to get rid of the endospores. Endospores are 1.5 times more resistant than the vegetative form. Radiation, the dose of X-ray that may be required. Again, don't care that you remember the units of grays. Simply remember that that for radiation, endospores are about 4 times more resistant. So 4,000 of these units as opposed to, 1,000. A sterilizing gas like ethylene oxide, again, requires a much higher dose than the vegetative forms, and a sporicidal liquid such as 2% glutaraldehyde. You will notice to get rid of the vegetative form only requires 10 minutes. To get rid of the endospores requires exposure for 3 hours. So all of these methods are effective against both. It's just the timetable or the exposure is much greater. Sterilization and disinfection are processes that use specific agents. All of these agents come in different forms. Some of them are very specific, such as a bactericide is a chemical that destroys bacteria, again, except for those in the endospore stage. A fungicide is a chemical that will kill fungal spores, the hyphae, and most yeast organisms. A virucide is a chemical known to inactivate viruses, especially when those viruses are on living tissue. A sporicide is an agent capable of destroying bacterial endospores. And a general term, a germicide or a microbiocide, is an agent that kills microorganisms. These generally are going to have a very broad spectrum of activity, and we'll talk about broad versus narrow spectrum in a later chapter. These tend to be very specific. If you've got a fungicidal infection, a bactericide will probably not do you any good. Likewise, if you have a virus, a fungicide probably won't do you any good. These tend to be multi-level sterilize or disinfectants. Most of the things that you can buy in the stores that you and I can buy that are available over the counter would be considered germicides. The growth of microorganisms in the blood or on other tissues is referred to as sepsis. Any practice that prevents those infectious agents from entering sterile tissues and thus preventing infections that process is referred to as asepsis. The techniques we use in labs, such as flaming the loop repeatedly and not opening bottles and leaving them open and barely lifting the lid on plates rather than taking the lid off and setting it off to the side. All of those things that we do, those are referred to as aseptic techniques. They are practiced in healthcare, and they range from sterile methods to simply antisepsis products. A chemical agent applied directly to exposed body surfaces, such as skin or mucous membranes, those are referred to as antiseptics. These are used to prevent the vegetative form of different pathogens. They can be used when preparing the skin for surgical incisions with iodine compounds. If you've ever had surgery or been in surgery or seen surgery on television, one of the first things they will do is swab the area to be where the surgery is to take place, generally with an iodine compound, unless of course that patient has iodine, and then there are other products that can be used. Why do we use iodine if people are allergic to it? Number one, it's a very good agent. It's one of the oldest agents we have. Probably the most important reason, it is reasonably inexpensive. Some of these other agents are kind of pricey. So if this one can be used, it's certainly still very effective, so we continue to use it. Swabbing an open root canal with hydrogen peroxide. If you've ever been unlucky enough to have a root canal, one of the things they will do to you when you've had that root canal is they will have you, or at least my dentist has me, sort of gargle with hydrogen peroxide 3 or 4 times during that procedure to make sure we're getting rid of all of the bad stuff that's in the tooth. And ordinary hand washing with a germicidal soap. We will talk about germicidal soaps a little bit later and my opinion of them, but that is an antiseptic technique. Stasis versus static means to stand still. Most of the agents we swallow that we call antibiotics are actually bacteriostatic in nature. Antibiotics excuse me, tend not to be bactericidal. In other words, they don't kill the bacteria. They simply prevent the bacteria from reproducing. By stopping their life cycle, then they live their life however many days that may be, and then they die a natural death. Same for fungistatic. These are chemicals that simply inhibit fungal growth. That's what many of the agents that we can buy, again, in the CVS or the Walgreens, those are going to be fungistatic agents, those antifungals that we can buy across the counter. Antiseptics and drugs many times again have a microbiostatic effect because microbicidal compounds can be toxic to human cells. Again, generally what happens in these cases is the toxins released by the bacteria dying suddenly can be harmful to our cells. It's not the agent in among itself, it's what the agent's doing to the bacteria. And even an agent that is cidal, and the word cidal means kill or die, homicidal. Even one of these agents does not necessarily result in sterilization. It all depends on how that particular agent is used. Let's stop right here. Let me give my voice a rest, and then I will pick back up after a while.